So with the opportunistic infections, the key is prophylaxis when it comes to pneumocystis. You don't wait for pneumocystis to develop, you prophylax. It's easy to prophylax. Now, this is where my bias comes in. One of the other factors when you add Idelalisib is enhanced neutropenia. So how do you prophylax without worsening the neutropenia? My preference is in these patients to use Dapsone. Dapsone is highly effective as long as patients don't have G6PD deficiency. And it's highly effective as prophylaxis for pneumocystis, but it doesn't cause blood count suppression. Many people will use Bactrim, but you have to be careful about blood counts. For CMV, we don't. The treatment is not so friendly. It's very myelotoxic. You don't prophylax for CMV. But if CMV develops, there are treatment available. So the key is monitoring. And the best guidelines for monitoring is what you would use to monitor in other clinical situations. We've adopted, actually at Memorial, the guidelines that we use for monitoring our bone marrow transplant patients who have a pretty similar risk of developing CMV, about the same. And so we do CMV titers once a month. And if there's a rising titer, we change to monitoring weekly. And if that titer is rising on 2 consecutive measurements, we institute treatment.